So I'm going to go ahead and get us started so that we remain on time. On behalf of the Michigan Health Improvement Alliance, welcome. I am Heidi Tracy, Chief Executive Officer. We are delighted to have participants from across the region, as well as from various parts of the nation and state joining us today for the first in a series of webinars. These sessions are designed to bring together innovators from around the country to inspire creativity, especially at a time when solutions may seem increasingly elusive. Earlier today, we provided an attendance list, but please feel free to drop your name and organization in the chat if you haven't already done so. We hope these webinars will help you reconnect with familiar faces and forge new connections with like-minded colleagues. The Michigan Health Improvement Alliance exists for a singular purpose: to empower organizations, institutions, and governments to build their capacity by working together, thereby ensuring that all residents can live their healthiest and best lives. In the face of ongoing complexities and challenges, we firmly believe that progress is only possible through collaboration. Our role is to unite people and organizations, providing the space for them to collaborate and innovate. Today, we are thrilled to bring together two outstanding organizations with whom we are proud to partner. Shortly, you will hear from Temi, Akintimehin, and Kara Woodward, our partners at Conduent. Both of them help us maintain our health data dashboard. Temi will reacquaint you with the functionalities of our dashboard and a resource that is open and available to everyone. However, data only matters when it is used to craft a compelling and inspirational narrative. By doing this effectively, we can not only help funders envision a brighter future, but also help build trust and credibility with all stakeholders. A strong case for support engages and motivates, fostering a unified vision that drives effective collaboration and innovation. That is why I am so pleased to have our partners from the CaseMade on our call today. They will begin this webinar with an overview of the 10 principles of strategic case making. With that, I am honored to introduce Michigan native Dr. Tiffany Manuel, known affectionately as Dr. T, and Samara Crawford Herrera, who will begin the webinar. Samara?
All right. Thank you so much. I'm so excited. And, even though I am not a Michigan native, I feel like y'all might need to adopt me from the far throngs of Missouri. So I'm excited to be with you all this morning. And at the CaseMade, we love a metaphor. Okay, we love a metaphor, and we got very excited in connecting with Heidi and the team and thinking about what it means to bloom, right? What it means to bloom. And when we look across our communities and our country today, we recognize that the conditions that allow for flowers to bloom in the unlikeliest places, right? We've all seen that little flower peeking out of the concrete, right? Just fighting for its life out there, right? But we recognize that this is also about everyday people who are joining together in solidarity to uplift each other. They're working in communities in beautiful, beautiful ways. I know you know that too. I would love if you can drop in the chat where you're seeing places where people are blooming, right? Where the flowers are fighting through the concrete. We see across the country community leaders listening deeply to residents and reimagining how they can better connect people to resources that improve well-being. We see committed health and community practitioners reinventing new ways to help people stay healthy and well. And we recognize that a lot of the systemic challenges that we're facing right now are unyielding. They're like that concrete, right? But we've also seen flowers emerge in the cracks. And we all know this, in our way of knowing that the tectonic shifts, they're happening right now across the country, but that we have a really unique opportunity to nurture the life that's under the surface, those flowers, right? To help it take stronger root, right? I'm not a gardener, y'all. I actually have a black thumb, but we'll unpack that later. So what we recognize is that our work is to remove the concrete that separates us, those silos that buries us under just unjust systems and weight. We've got to be like, what's the guy with the jackhammer? Cracking up that concrete so that the roots underneath the surface can get life, they can be resourced, and we can see that our communities are strengthened and able to thrive together. So at the CaseMade, we believe that this is the moment. I know, maybe a hard day, but this is the moment. This is the opportunity that we have to bring new champions to the work that you're doing every day and look beneath the surface, beneath the concrete, and see that the systems are not built for everyone to thrive, but that in order to do that, we have to do a few things. We've got to break up the hard surfaces, right? The hard things that make it hard for your ideas to grow and to scale and to add more resources to support human thriving. In other places, we've got to plant new life in pastures. We've got to spread seeds. We got to, float them around, get them out there, right? In places that have been long forgotten, they're underused, they're under-resourced. We know those spaces, right? That's where the flowers, that's where we've got to sprinkle the seeds now. And in other places, it means that we've got to bring more gardeners, right? And that's your community. That's what we're talking about. You got to bring some new gardeners, some new people to the existing fields so that you can grow what's already starting to thrive. But we know that that happens when we use some intentional, we call strategic case making. So let's talk about what that means and what that means for the work that you're doing. Okay, so I don't know why my screen shifted this way. Dr. T, she's on here today, Michigan native, just like you, was experiencing a lot of the similar issues in her work around affordable housing. We were seeing lots of money pouring into development. Developers were getting really good and really smart at building stuff, right? In all kinds of communities, things were going up, developments right and left. But even though we recognize that the technical aspects of building, right, getting housing up it was getting easier, but it was not meeting the challenge of building public will, right? It was getting harder and harder and harder to bring people to the work and to find new champions for the work. So Dr. T, who is a researcher through and through, I'm always learning new things. I'm like, oh, I didn't even realize, that exists. There's a study for that. She dug into 30 years of good social science behind persuasion and how people think so that we could start thinking differently and solve some of the real challenges in front of us, right? And that's where strategic case making as a framework comes from. It really focuses on 10 powerful leadership principles, right? It's a distillation of social science and practice. It's the combination, it's like the 1-2 punch of things, right? That helps bring together what we know meets the leadership moment that you're in. And this moment, y'all, requires a whole new different type of leadership. It's a leadership that can harness people's bigger aspirations, right? People are aspiring to things every day. And so part of that work is being the leader, the adaptive leader, we say, that can change the energy in the rooms and connect to people's fundamental desire for good, for hope, for future, right? And how to do that in radically inclusive ways. And so we offer this up, the book, The CaseMade, in thinking about how we engage people differently, more meaningfully, and more authentically around the work. And because strategic case making is really about tapping into and helping to reignite a sense of potential, right? A possibility. It's the thing when we, lean across the table and we talk about what's exciting in our kids and our families' lives. Our eyes light up. You can feel the sense of excitement. That's what we want when we bring people to the work that we're doing every day. It helps to leverage what we can accomplish together. So there are 10 principles, and you can see them kind of laid out on your screen before you. But today, because the topic of the conversation we're talking about is data, I want to focus on 2 principles specifically. They're principles 5 and 6, and they're how we think about anchoring credentials and credentialing solutions and not our problems, and how we do the work of making inequitable systems the villains, not individuals. And I think all the time, a little bit about my background. My goodness, y'all, I'm the give it to Mikey, she'll lead it. I've had just about every type of job that I think is about working with people and advancing folks' aspirations. I have been a kindergarten teacher. I have worked in philanthropy. I have run a nonprofit organization. And the common denominator across all of those things is I was not using these principles at the time. And it was really hard. It was like so hard, y'all. Because I'm like, why is this hard for folks to dig into children's literacy? It's so hard. We gotta, I remember being frustrated. And maybe far away, I use expletives to describe why I felt like people did not care. People did care, but I've spent a lot of time anchoring problems and not solutions, and thinking about individualism as opposed to systemic issues. So I want you to kind of focus on those two. And I've already told you I'm a kindergarten teacher, so I like a little interaction. There may be coloring and crayons later. I cannot guarantee nap time, but this is certainly interactive. Sound fair? Okay. So one of the things that we talk about when we approach people, right? We want to really get people energized to what the work that we're doing. You know this, you go out to have a community meeting, or you're meeting with a colleague in a different area. You're approaching them to join the work, right? To join you in the important time of the moment that you're in your work. What you're really doing is asking them to make a choice. We call this kind of visual the two tomorrows, right? The choice on the right toward the rainbow is working with you and walking down a path to a better future, right? It's what you want, right? It's the justice that we seek, right? We recognize how important, we want folks to see that we can get there. But often we meet folks right in the center of that, and the choice on the left is inaction, right? Or worse, what we feel a lot of today is opposition. And we see all the ways in which that often shows up, right? Individualism. We see it in racism and bias and fear, fatalism. Oh no, what will we ever do? And it's not that folks want to choose that, right? Like no one wakes up in the morning and goes, I think when I go to coffee, I'm going to let my fear flag show. I'm just going to really be terrified about, I don't know, making sure people have access to the highest quality healthcare. Most people choose the path on the left. It's the way our brains work because we're rooted in, we want to be safe, and change, even if it means joining toward a path toward justice, is really scary. Right? It means I'm going to have to change something about how I show up. And change feels impossible because we can't compute it. It feels like it may never happen. The timeline is so far out. It feels like sacrifice, and people don't want to lose what we have, right? These are natural ways that our brain works. It's the chemistry of being human. And that's all wired from millions and millions and millions of years of evolution. And so we're asking them to make a choice in those moments. And if we're asking them to be different and to change different, right? We've got to show up differently. So oftentimes what happens is we need folks to believe that we can achieve a thriving future. We need them to believe that, right, all of the solutions that we have are possible, right? I don't care what you're working on today. It's a solution for where we are today. And you need folks to be excited about that. But often, y'all, and I'm saying we, because again, as I shared with you, my journey and my struggle as well, is we often walk out our data in a way that anchor folks here. And let me be very clear about how I want to make sure we're understanding this. Being data informed is essential, right? Dr. T and I would call ourselves self-proclaimed data wonks, right? I love my 17-year-old will tell you, where I'm like, you guys aren't going to believe this. Look what I read today. And she's like, excuse me, like, this is not the conversation I want to be having. We can unpack raising teenagers later. We're not talking about the importance of data. We are talking about how we walk our data out into the world, how we share it with the individual who is terrified of the change, of the sacrifice, of the future, so that they can get to path to justice. It's how, right? Not the what, because the what is really important to understanding the depth and the critical nature of what we're dealing with, but the how we share it with folks and how we get them inspired and how we connect to their own personal aspirations is really important. And that's the adaptive leadership opportunity that we're in right now. So by no means, what I'm about to show you next, this is, like I said, this is an interactive. So if you're in the chat, I'm going to talk through things, and I'd love to be able for folks to go, ooh, it's okay. This is a safe space, okay, to be able to say, I've walked something like this out. I'm going to tell you there is a graveyard of these things that I have worked on and personally rolled out as it pertains to data in any context. But here's how we can really start to flip it and think about it differently. Okay, we've got this flyer, this flyer, this what do we call it? A 8 by whatever flyer that comes home. It goes in the mailbox. We send it out with people because we have just learned some really compelling and important data, and we feel like we've got to be able to share it with people because it's really impactful. Oh my gosh, it was eye-opening. It's a thing you can't stop talking about at happy hour or at brunch with family. And so we were like, I got to get it out, because the expectation is that if people know, they'll change their behaviors, right? They'll get rallied. They'll be encouraged. They'll be like, hot dog it, lead me to the next battle that we have. But this is where we get into something we call the backfire effect. Okay, backfire effect. There will not be a spelling test or a vocabulary test later, but certainly take it down. And here's what the backfire effect is. It is in the face of contradictory evidence, right? Contradictory evidence, something that completely refutes what we know to be true. Established beliefs do not change, but they actually get stronger. And this backfire effect has been demonstrated in hundreds, probably, of studies over many decades, right? That when people are given data that either reinforces or goes against their own existing biases, and y'all, we all have them, right? Our understanding of the world, the way we have come to understand how we work together, our biases, some great, some that have helped us stay alive for many years. What happens when we're introduced data, right? It either reinforces it or it goes against it. Our confidence in our prior position increases regardless of the evidence that we're faced with. Complete fact. We dig in even deeper. So what happens is I get this flyer at home in the mail, shared with me in some way, shape, or form. And this is a mock-up. This is, do not go to kidsusa.org. This is not them. I don't want y'all beating up the fictional kidsusa.org. But what we do is we do several things. And I would love if, like I said, if you're seeing some things that you're thinking about the backfire effect and you're seeing some things in this flyer, I'm going to point out a few things that kind of speak to this, right? What do we see? We see a visual, right, that reinforces bias or individualism. I have a daughter, but I have nieces, I have nephews, right? They all kind of look like this sweet young man. And if I have biases, this is where they start to, like, around race, and it starts to find some anchors there. Remember, it's around anchoring these things. What else? We just provide a context, no comment, just child poverty. And oftentimes we understand so much. I joke all the time, the acronyms that we use, right? We speak a whole other language. What is poverty? If I'm someone who is of lay community member, what does that mean? It has no context to me. It's negative. I don't want, poverty sounds awful. I don't want that. But it has no context. It's not connected to anything. What else do we see here? The data is not compelling. more than 1 in 5 children live in families with income below the poverty line. Well, in my head, I'm like, well, 1 in 5, that's 20%. That means 4 out of 5 are doing okay. 80% are fine. I don't know why I needed to know this data. 80% is a passing grade, should be fine. It's not compelling. It's not positioned in a way that goes, okay, wait a minute. There's something for me to lean forward into this, as opposed to going, well, take care of the 1 in 5 then, because the 4 and 5 are okay, right? What else? What else happens? What else shows up in a flyer like this? We attribute the responsibility of this child poverty to the families. They live in families. It's the family's choice. Somehow we don't, so we're not talking about the systemic issues, right? That position families for winners, for losers to be in these conditions. But it's the family's fault. So what does someone say? Well, the family just needs to do better. What else happens? Whew, we start talking about negative data that it attributes to certain behaviors and dominant narratives. Well, this makes sense. Risky behaviors like smoking and early sexual activity, well, that makes sense for those types of kids, right? It might be very well true. The data tells us this is true, but walking it out again and how we do that matters. And finally, my thing, if you walk away with anything else, is we leave with weak calls to action. I've just given someone all of the weight in this flyer, again, of this data. And the only ask is just go to the webpage to learn more. And we know, y'all, I'm sure we all know how often that happens, right? Doesn't happen very often. But we're not asking, we haven't leaned into what does action feel like, right? What is the first choice that an individual who is along this left path can make to join you on the path on the right? So oftentimes we pack in an amazing amount of data and we leave it with weak calls to action. But we can do it a little bit better. We can be different, right? Because ultimately what I want you to think about finally is 3 things with your data. What's the story that you're telling? What's the story you want to tell? What's the data that helps to tell the story? And finally, how are people being called into this story? Not being told the story, but called into it. If you've ever been to a story time in a kindergarten classroom, a lot of call and response. We call our youngest learners into the stories that we tell, right? When we do circle time, or we've got the picture book holding up, we do that because when we identify with the story, we figure out who is the hero and what can I do? What is the actions that I can take? The data makes sense to the story. We're moving forward. So as I get to wrapping up with this, I want to offer you just some ways that we think about what we call flipping your data. And it's really hard, y'all. I call this the brain rewiring type of activity, right? It's super hard to flip this data. But here's a few examples. Often we say, on any given night, 300 people in our community sleep in places not meant for human habitation. But what does it mean when we can say something like, right? When we work together to solve homelessness, we gain 300 more neighbors, right? Who can experience the joy of living here and contributing their strengths here. And we get to experience what resilience looks like in our community. That's a really powerful reframe of some important data. It's an important number to know, right? I'm going to skip to the last one. Heart disease death rate for Black community members was 27% higher than for white people. That's the data. But when we walk it out, right, think of the story that we're telling about the Black community and what it means to be in comparison to our white counterparts. Well, what does it mean if we flip that data? We asset frame it. We know that ending chronic heart disease and improving access to high quality healthcare for our neighbors' health and well-being is an important thing to do over the course of a lifetime. Those who no longer experience heart disease get to live longer, enjoy more birthdays with their loved ones, and experience the joy of full lives. That's a story I want to be a part of. I like birthday cake, right? And we know that the work to eradicate heart disease, the components of heart disease mean is the solution that we want people to focus on, right? So we reframe the data in that way. So finally, just in conclusion, just a little bit about the CaseMade. We work across a number of different impact areas that impact the lives of people every day. We work across three what we call movement building approaches, where you can learn the building blocks. It's a little bit of what we've talked about today. We help to work to design cases, and then we you to think about how you can align your stakeholders toward a bigger case. This is the moment for that. You're in it. You're the adaptive leaders that we need right now. And so we are excited to be here. We're excited, like Heidi's never going to get rid of me. I think I've told her that already. And so we're looking forward to continuing to work together and to partnering together. But certainly as you're digging in and getting stuck, we want to always make sure that you know that we're here for you, that this is hard brain rewiring work, but it is essential to break up that concrete so that the flowers that you are planting, that you are stewarding, can thrive. Thank you.
Thank you, Samara. So I'll go ahead and jump to some of the items for Conduent. Go ahead and share my screen. Perfect. All right, so now I'm going to go over some of the Conduent Healthy Community Institute background information and just give you a little bit more of an idea of who we are and what we do. So HCI has been a leader in the community health field for more than 16 years. We have conducted over 400 community health assessments and implementation strategies with partners all across the country. We also provide strategic direction for community health initiatives, and we've been known for our award-winning customized technology platforms. In addition to that, we are a multidisciplinary team of public health professionals. So that includes folks within the health department backgrounds, folks who have worked for large health systems and hospitals, researchers, data scientists, epidemiologists, as well as an experienced team of developers and web designers. With that, we work with clients across the country, including hospitals and health systems, health departments, as well as collaboratives and nonprofits. When it comes to our solutions, they are unique to each client to improve the health and well-being of the communities that they work with. With health equity data and services, it's pretty much the heart of everything we do. When it comes to our community health platform, we consider it a place to find centralized data, which allows clients to uncover health disparities and inequalities within their communities. And then last but not least, we do have assessment and planning services where we act as your partner in achieving your community health planning process. So think about your CHAs, CHIPs, and CHNAs as well. So when it comes to the actual platform, with MiHIA specifically, their dashboard consolidates over 332 community indicators that allow you to monitor and improve community health. Instead of taking time and resources to find and collect the data, you will use the resources to impact the community utilizing the assessments and the reports from this dashboard. For the platform itself, it is built with a set of core indicators that come from a combination of 44 national and state data sources. The data is updated continually throughout the year, and most sources update annually. Overall, our promise is to have those updates reflected on MiHIA's health dashboard within about 90 days. As of right now, approximately 60% of the indicators are tied directly to health, and about 40% of those are tied to QRL measures. For MiHIA, the data available is concentrated to the region, county, health district, census places, zip codes, as well as census tract levels. In addition to that, we do provide a social needs index suite, which is a robust tool set embedded within the HCI platform. This helps identify and support under-resourced communities using data-driven insights. The suite itself integrates analytics focused on social determinants of health to promote equitable and connected care. Displayed as an interactive map is one of the leading tools for assessing, planning, and collaborating on community health improvement. So you can see here we have the food security, health equity, and mental health indexes. The health equity index measures social factors linked to preventable hospitalizations and early deaths, while the mental health index assesses social and health related factors that impact self reported mental well being. And then, last but not least, the food insecurity index highlights food access challenges tied to economic and household hardships. So, overall, these tools help the community take action and drive meaningful change. When it comes to the dashboard itself, HCI provides indicators in a number of different data visualizations. Multiple comparisons are noted, such as trends or even national targets. And then we also have curated dashboards that show quick overview of the data. For our indicator page, while our indicator detail pages provide an in-depth insight with customizable charts that track trends over time, when available, they also highlight disparities by age, race, and gender. Each of these elements are available to download in graphic or CSV form to use in your own reports or presentations. For our geographic insights, each indicator with data from multiple locations is mapped to provide geographical insights. The mapping feature lets you overlay different comparisons and help you see patterns across regions. You can also use a customized view of your map before exporting it for reports and presentations. For our all local data, the platform allows you to add an unlimited number of local indicators to MiHIA. If there is data that your organization collects, please let us know and we can see about adding it to the site if it is a possibility. Last but not least, I wanted to also show you the insights for the community that kind of shows you what our prompts and practices allow. The prompts and practice program is an intervention or policy that has shown successful results in improving community health. HCI provides a national database of over 2,000 documented practices to help health professionals and communities adopt and implement effective strategies. These practices themselves are ranked based on their impact and supporting evidence. So this resource helps communities learn from each other and apply successful health initiatives nationwide. So we'll be able to go into more depth about how you can search for prompts and practices and apply them to the community that you work with. Now that we've kind of gone over the platform itself, let's go online and I will walk you through the overview of how to utilize the platform. All right. So the MiHIA's dashboard Health 4.0 can be accessed from MiHIA.org and coming right over here to the Health dashboard, or you can also go to dashboard.mihia.org and it will bring you to the dashboard itself. Dashboard 4.0 creates a common place for data to be obtained, allowing individuals within the region to gain a quick access to information that can help improve the overall health and status and quality of life for communities throughout the Great Lakes Bay region. Here you can find a centralized public platform to share health, equity, and quality of life data using data visualizations for over 330 indicators from 40 sources. The homepage itself has an easy access to find items such as data, disparities, grants, reports, as well as upcoming events. At the top here, we do have the navigation bar that allows you to have quick access to the information you're looking for. For the tools and resources, it takes you to where you can find data and reports on the dashboard. The Get Involved tab allows you to go to additional resources and allow those visiting the site to submit resources such as funding opportunities, and promising practices. And last but not least, we do have the Bloom scorecards. So for that, we're actually going to jump into one of the scorecards, which is the MiHIA Region Bloom scorecard. All right. Here, you'll be able to find the Blue Scorecard report for the MiHIA region as well as each of the 14 counties within here. The scorecard report itself pulls out a select economic and health and well-being indicators to easily track over time and compare within the region. These indicators automatically update as the source updates so that it shows only the most recent data. Many of the visualizations here are interactive. So you can see they are interactive when you hover over. And you can download and save each graph or chart by clicking the little hamburger icon here, which allows you to download as a JPEG, PDF, or CSV file. In addition to that, at the bottom of the page, let's go a little quicker down here, you have the opportunity to, there we go, click and print or export the entire report as a PDF. So that was just pretty much the Bloom scorecard report. Next, to learn more about the data on the site, we are going to visit the dashboard landing page. To get there, we come over here to Tools and Resources and then go right to Find Data. I have it already pulled up. Perfect. So this is the Community Health Dashboard. This is your landing spot to find data on the site and complete detailed search of all the data that is available. We do have a couple of features of how you can do the search. For example, the first feature we have is to search by keyword, where you can type directly into the text box and it will pull up all related indicators that you can jump directly to. So for example, if you wanted to search something such as poverty, there you go. You'll see that these are all the indicators related to poverty that we do have on the site itself. For knowledge bases on our platform, an indicator is something that describes an aspect of the population. So that is what we use to measure the health or quality of life. In addition to searching by keyword, you also have the option to search by the indicator drop down here, where all the indicators on the site are organized by health topic first and then subtopic alphabetically. So again, if you typed in poverty in this section, it will pull up the same indicators that we saw on that list, but just within their subtopic area. And then last but not least, you have the option to search by location. All locales on the site starts with the largest and then goes down from there. So it starts by the state, region, county, and then we also have census places and census tracts. For example, if you're not aware of what your census tract or census place may be, we have this cool little feature here to the right that allows you to utilize the map to search. So if you click this right here, it'll pull up the map of the region. And then let's say if you want to look at the census tract and see where your location or community actually overlaps, clicking the census tract would populate the different areas where the census tract information is. And by hovering over the areas, you'll see which census tract is assigned to the area that you are focused in. Okay. That's the map on there. All right. In addition to the search feature, we also have some pre-built dashboards on this community health dashboard page. All of these are around specific focus areas. As you can see, there are brief descriptions under each of the dashboards that are located here that gives you a little bit idea of what each of these dashboards are focusing on and gives you more information about what you want to look into, in addition to seeing a full list of all the indicators and the location data available for them. So one of the first dashboards I want to go into to show all of you is the All Data dashboard, which contains data for all the indicators at all locations that we have right here. Perfect. So this is the All Data dashboard. This dashboard, again, displays all the indicator data for the region when available on the site. The indicators do come from both national and state sources, and the sources are updated annually. This currently displays all the data on the site for all locales. However, if you want to go to a more specific locale area, you can come over here to this drop down and specify the area. So right now we're looking at all the data for Michigan, but let's say we wanted to look at a specific county such as Bay County. We can click that and the dashboard itself will update. So when looking at the dashboard, we have it organized based on area. At the moment, we have it as Bay, and then you'll see that we have the topic area, subtopic area, indicator name, the value, the period of measure where the value was collected, as well as all comparisons available. In addition to what you're seeing on here, we have this great legend off to the left that is pop in and outable that allows you to see a little bit more information on what the comparisons are detailing. So this allows you to see how we are breaking down the comparisons based on distribution, how they are comparing to certain targets, as well as how they are comparing to single values. In addition to having this legend here, we also have this great more button at the bottom right corner that takes you to our help center that takes you to an article that goes more in detail about all the comparisons that you are seeing on the dashboard. So in addition to what you're seeing here, the comparisons as well as the indicators being rolled out on this list, we do have a feature here on the top left underneath the geographical drop down that allows you to see the data in card view. This card view, you'll see when we click it, it takes each indicator and turns it into a downloadable graphic. When you click this Save Card button right here, it allows you to save as a JPEG, which can be utilized for reports, presentation, or even grant writing. In addition to that, for those who may be color impaired, we do have a colorblind mode that when it's turned on, you'll see, there we go, some thumbs up and thumbs down around some of the comparisons. This will be a very great feature that allows you to, when you are printing out maybe in grayscale and those individuals are not able to see the green or reds around the comparisons, they're able to see how the comparisons are doing, comparing favorably or not favorably. So this is the all data dashboard. So now that we've kind of reviewed a dashboard itself, let's kind of look at what an actual indicator looks like and what that detailed page looks like as well. So for that, we can come right back down to the community dashboard and actually search for indicators. So let's say we're looking at access here. Come over here and type in access. And let's go to adults who have had a routine checkup as our indicator. So when you click into this, it will bring you to the indicator detail page. So overall, the indicator detail page is designed to give you more information about a specific indicator, including values for specific locations, changes in values over time, as well as details about different subpopulations when available. At the very top of the page here, you'll see that we have the name of the indicator and drop-down menus for locales and measurement periods. So right now, the county we are looking at is the Bay County. However, we wanted to toggle through other counties for a specific indicator. We can select from here. And then for the measurement period, it always shows the most recent period that we have data available. So for this, we do have data available from 2022. However, if you were interested in looking at historical data on this actual indicator, you can toggle through other years from here. Right under that, we do have the indicator definition. So this is what the indicator is measuring. So this is showing that this indicator shows the percentage of adults that report having visited a doctor for a routine checkup within the last year. Then right underneath that, we have the why is it important section. So this pretty much gives like a summary of why we are considering this indicator important. A lot of time, folks who come to the indicator detail page and they see this little brief blurb about the indicator, they're able to pull content and information from here when writing proposals for grants to kind of like summarize why they are trying to receive funding for a specific area, or even get data that support a finding that they are pushing forward for their grant or proposal. As we scroll down a little bit more, you'll see that it goes more into detail about what is going on with this indicator and what data is supporting it. So over here to the left area, it is kind of reiterating what we're seeing at the top. So the county that we are specifically looking at is the Bay County. Right underneath that, we have the value showing 79.4. Next, we have the source data, so where the data is coming from. This is currently showing that it is coming from CDC Places. We have the measurement period of 2022, who it is maintained by, and then when this data was last updated. In addition to that, we come over here to the right, we are seeing the same comparison icons that we were seeing on the all data dashboard. However, on this feature, one of the fun things you can do when you do come here is that when you do hover over the comparisons, it goes into more detail about what you're looking at, as well as what the comparison data and values are showing. So, for example, with this one, the US value of the green arrow pointing up is showing 76.1. It is indicating that this 79.4 for Bay County is higher than a US value of 76.1, which is trending up and is green. So we're considering this as a good data point. As you scroll down a little bit more, you'll see that we do have some technical note as well as more information that can take you to how to use the CDC Places data. And then we additionally have some graph that shows data over time. So with this graph, it shows the data over time. And when you come over to this hamburger icon right here, it allows you to not only download this graph by JPEG, PDF, or CSV, but you also have the option of showing confidence intervals, like so, or even changing the the zero-based y-axis to make the graph tighter or tighter or wider. So there we go. In addition to that, we do have some mapping visualizations as well, that the map is also tied to a table and chart. You're able to overlay comparisons on the map, and similar to the chart above, both the map and the table are downloadable. So these can also be shared. And then scrolling down a little bit more, we have the table that is reflecting the data that is pulled up on the map as well. In addition to how the map is, this table can also be downloaded as a CSV file. So this is the overall indicator detail page. When you scroll all the way down to the bottom, you'll see that we have some additional resources that are available that tie into other indicators around the one that we're looking at. So you see adults without health insurance, children with health insurance. We have some links that take you to prompts and practices related to this indicator, some reports related to the indicator, as well as additional resources. So overall, this is what the indicator detail page looks like, and this pretty much gives you a summary of what the indicator shows, as well as how the data is being reported. So now that we've kind of gone over the indicator detail page, as well as looking at data and how to find data, we wanted to also take this time to show you how you can build your own dashboard and search the data on your own. So for that, we'll come right back to find data. That takes us to the community health dashboard, and then we'll come over here to this advanced search feature. Cool. So you'll see here, it takes you to advanced search, how to build a custom dashboard. So overall, users can complete a drill down search and create their own custom view of data from coming here. They have the option of doing hand-picked indicators for locations, or you can filter by specific locations as well. So for this example, we're going to just kind of go through how we can kind of use these filters here to build a dashboard for our own. So coming over to selected ones, first we're going to go to filter by let's go back to this. Let's go to filter by topic. So seeing that this focus of this webinar is around optimizing health and care, let's go to a access topic area. So we're going to go ahead and select healthcare access and quality as our topic of focus. Perfect. Next, you have the option of filtering by population. So if you're looking for data for adults, children, infants, or other subpopulations here, you can select a group from this dropdown. You have the option to filter by classifications. So let's say if you wanted to see data specifically on social determinants of health, you can come here. Next, you also have the option of searching for or selecting comparisons. So for this one, comparison-wise, let's kind of have this comparison be compared by Michigan, the state of Michigan. Let's see. Let's do par value, trend over time, and a Michigan state value. Gosh, into. There we go. There we go. Yeah, Michigan state value. Okay, so those are the comparisons we're going to choose for this example. In addition to that, if you want to see a subgroup data such as age or gender, that can also be selected through here. And then last but not least, we have this filter by sources option that allows you to see one of the places where you can see all the sources available on the site. So if you wanted to just find data specific to, let's say, the American Community Survey or even CDC places, you can select that source from here and it will filter just from that. So now we kind of filled in the areas we wanted to filter for this dashboard. We're going to come over here and say group by location and press search. All right, and then as we scroll down, we have built our own dashboard. So as you see, the dashboard pretty much resembles the all data dashboard that we saw previously, where you see the topic area, then subtopic area, values, and then comparison values. You can see how we are comparing. So if it is red, if it is green, if it is up or it is down. And then with a trend over time, you can see that when it is a filled background, it means that that there is a significant trend, whereas if it is a blank / not filled background, it is indicating that it is not statistically significant just yet. So overall, these are just a great way to kind of see a good snapshot on the site of the data and how they are flaring together. In addition to that, for the dashboard search that you do, you also have the same feature of changing the information to be viewed as a card view. So you're able to see the breakdown like this, and still have the option to save each card individually. And then if this is a dashboard that you think you may want to revisit or even share with other colleagues or individuals in your organization, you're able to come to the Save This Search link and copy this, and this URL can be used for later and shared with a friend. So this URL, once you have it created for your dashboard, will always be something that you'll be able to access, and this link will remain the same even as data updates. So if you wanted to share and actually have this saved, this is a great feature to have on this. Okay, seeing where we are on time. All right, so now that we've kind of went over the interventions of addressing optimizing health and care, the one last thing I want to show you is the promising practice module, which can be accessed again from Coming Tools and Resources and coming over to Find Promising Practices, which I have right here. Perfect. So again, the Promising Practices module is a collection of programs geared towards improving community health that is shown to be effective. There are over 2,400 promising practices in the database. And then within promising practices, you are able to search by keyword, ranking, featured sources, target audiences, as well as topic and subtopic areas. In addition to that, we do have the ranking kind of based on specific standards so that when you are searching through the promising practices, you're able to see how the rankings apply to it, and you're able to narrow down what you're looking for. So currently we have it on a 3-point ranking. We have it, the first one as evidence-based practice, which is considered statistically significant and the gold standard. Next, we have an effective practice, which is evaluated but not statistically significant. And then last but not least, we have a good idea, which is considered maybe something that hasn't been given enough time or resources available for evaluation, but can still be considered a good practice. So this is just another good way to just kind of utilize what the resources that we have on the site itself and kind of toggle through practices that can be applied to your community. Okay, so going to come back to this and just kind of peruse. Oops, there we go. Come all the way down to here. I don't know why it's doing that. Stop sharing. There we go.
We did have a quick question in the chat that I know that either you, Temi, or Kara would be able to answer best. Is census tract the most granular level of data for reporting, or county level, or does it depend on the data source?
For that, I will pass that question over to my colleague, Kara.
Thank you. Census tract would be the most granular level that we have available on the MiHIA dashboard. However, it is source dependent. So for census tract, we actually have, let's see, I can tell you right now. We have 96 indicators with that level of detail available. Thank you, good question.
We have thrown a lot at you today. Are there any other questions for either Samara, Temi, Dr. T, or Kara? This is the time to unmute your microphone and ask away. Well, I think that is, I do know we threw a lot at you today. And as I said at the beginning, this is just the first of a series of webinars. In the next couple of days, you'll be getting a recording of this webinar so that you'll have it. And then along with that, it's just a very quick survey. I think we have 4 questions that would help us really inform how we continue with these workshops, what you will find helpful, what you'd like to see more of, what you'd like us to spend a little bit more time on. If there's some information. We're also, because of our partnership with Conduent, we have quarterly office hours with them. If there's some time that you would like to be part of that, certainly come in and we'll make sure that you know when the next one is coming up. And we're always able to try to help troubleshoot. But with that, I appreciate your time and attention today. And we're looking forward to continuing to working with you throughout the year. But thank you very much for everything you do to make our community a better place to live and work. Thank you.